Okay, well, thank you so much for having me again. And I believe that some of you may have been here before my last talk on nutrition counselling and education. So thank you so much for having me here again. It's lovely to see your face as well on camera. So for any of you that weren't here before, I would like to just introduce myself. So my name is Rebecca Taylor. I'm based in the UK in Cambridge. You might know Cambridge University. Can't say I actually went there myself, but I do have a master's and an undergraduate degree as well in nutrition. So my background is undergraduate in nutrition studies and then a master's in more personalized nutrition. So looking at individual DNA and how that impacts our nutrition needs. So that's really a passion of mine, is how we can personalize nutrition to optimize individuals' health, really. So that is my main area of work. And within that, I work as a consultant for particularly personalized nutrition brands, helping them to formulate products like personalized nutrition products, such as a meal shake based on your DNA results, for example, or a greens powder, which is also personalized to your specific needs. So alongside that, I work one-to-one with clients. And I love using functional testing. So these are things like microbiome analysis. We look at blood results, some of which I'll talk a little bit more about as well during this talk. And these are mostly to address things like gastrointestinal issues like IBS, IBD, and hormonal imbalances, whether that's insulin resistance or PCOS, for example, which is polycystic ovary syndrome. Or DNA testing as well, of course. So that's a little bit about myself to start off with. And bear me one moment, I'm just moving some things around on my screen. So this is not quite reaching the whole presentation slide, but I think it's okay. So the objectives of our class today, well, we want to learn about what clinical nutrition entails. So basically clinical nutrition involves the actual application of nutritional science to particular patient care. And this will be maybe a little bit more focused on potentially a hospital setting or more of a clinical setting. And I'm not a registered dietitian. That's a slightly different qualification. Where dietitians are based in a hospital, whereas nutritionists are generally based in public health. So it's a slightly different area that we work. A lot of people are confused about the difference between nutritionists and dietitians. But we will be talking a bit more about general clinical nutrition, such as weight loss, for example, which obviously, unless someone's having bariatric surgery, is not going to be dealt with by a hospital setting. So clinical nutrition basically includes assessing a person's nutritional needs and developing a tailored dietary plan to help them get to that optimal health, or to help prevent or reverse chronic disease. And it will involve usually monitoring their nutritional status alongside that. So we also want to explore its importance in different healthcare settings. Like I said, clinical nutrition is particularly crucial in hospitals or long-term care facilities, or outpatient clinics, and maybe community health centres, which I have worked in. So that's a bit of my own experience there that I can bring in. And clinical nutrition really supports particularly recovery from illness. We're going to talk about this more obviously in detail, managing chronic conditions and just overall well-being as well. So we also want to understand how it applies to disease management and patient care. So basically, clinical nutrition really plays a key role in managing conditions such as like diabetes, cardiovascular disease, and malnutrition, which we're going to talk about a bit in I think it's the next slide or one after that, about overnutrition and undernutrition. So, and how personalization comes into providing the best nutritional care for patients, and also a bit of education as well, and how crucial that is. So what is clinical nutrition? Obviously, I kind of spoke about that in the last slide, but the definition really of it is the study and overall analysis of the relationship between ingested food and the overall well-being of the human body, and even more specifically, how these nutrients are digested, transported, absorbed, stored, metabolized, and utilized. So quite a complicated sentence there, but obviously a lot goes on internally when we ingest these nutrients. And actually that's quite a lot of what I do personally, is look at an individual's DNA and how their DNA affects the way that nutrients are absorbed by the body. So some people will have a particularly efficient gene, shall we say, at maybe metabolizing vitamin D, for example, whereas other people, these vitamin D receptors aren't going to be quite as efficient, and they're going to need more vitamin D supplementation. So today our focus is particularly understanding the vital role of clinical nutrition in health and disease management. So this is quite an interesting definition, and I don't know if you agree with me here on this definition, which I quite like actually. So the World Health Organization, which I'm sure you've all heard of, have defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So I think that's really interesting. I like the second part of this. It's not merely the absence of disease, which was the old definition, but now they've added this in. It's not just if you don't have, not necessarily, you're healthy if you don't have scurvy or I'm trying to think about that, or beriberi, these more these nutrient deficiencies that people suffered with maybe even just a couple of 100 years ago, that we don't really, especially not in the Western world, we don't have these issues so much. But actually it's also talking about mental well-being as well, not just physical and social well-being. So yeah, just interested to know if you agree with that. Maybe put it in the chat if you agree. Would be good, would be interesting to hear your thoughts on that. So now talking about malnutrition. So also interested to hear your thoughts on this, whether you think, and you may not have heard these terms before, whether undernutrition or overnutrition is more of a problem at the moment in the world. And it's a big question. Obviously both are a big problem. So well, let me first define what each one is. So undernutrition, you may be more familiar with this term. So the definition is it's an inadequate intake or absorption of essential nutrients. So usually caused by, say, not having enough food or not absorbing these nutrients properly, or you might have an increased requirement due to illness or pregnancy, for example, maybe old age, for example. So, for example, protein, energy, malnutrition, and micronutrient deficiencies could be an example of these. So, for example, when we get older, we can have something called sarcopenia, which is where muscle loss tends to happen. So fat gain increases, but muscle gain decreases. So this is where usually muscle wastage can happen. And that is very much undernutrition, and definitely is a problem for elderly individuals, particularly, as we tend to not be able to utilize protein quite as efficiently as when we're younger. And yeah, so effects could be stunted growth, weakened immunity, cognitive delays, and increased susceptibility to infections. Now, obviously, this is going to be a lot more prevalent in third world countries. Not so much an issue, for a lot of countries now as globalization is increasing. But so overnutrition is the excessive intake of nutrients, often leading to obesity and I meant to say related health issues. So yeah, I mean, this is now becoming more the issue, is that we have a surplus of calories in our diet, but they're not usually the right kind of calories. So for example, I went to Fiji on a type 2 diabetes prevention volunteer kind of mission, and it was very interesting to see that the changes they've had in the last 20 years, with now 1 in 2 people are pre-diabetic or diabetic because of the influx of these processed foods. So going away from their traditional eating habits, to now having access to quick, cheap and easy calories, basically. And this is causing lots of problems for particularly type 2 diabetes and high blood pressure, hypertension. So you might be with me on thinking that this is now becoming maybe perhaps a little bit more of a bigger problem than undernutrition. So now moving on to the key components of clinical nutrition, which we're going to go into a bit more detail. So, and please do put any questions in the chat as well as I go along. Would love to answer them at the end. So you may have heard of the terms macronutrients and micronutrients. So macro being big, micro being small. So macronutrients include our carbohydrates, protein, and fats. And some people might say fiber is the fourth macronutrient, but it kind of is within carbohydrates. So we generally have those three. Micronutrients, I think we have over 40 essential vitamins and minerals. I should know that off the top of my head, but it's over 40 or 40 around. And fluid balance, so water is often forgotten about in its importance in nutrition. So obviously essential for cellular function and overall health. It's, yeah, if we're lacking in water, it's the first thing we would, or if we're lacking in anything, what am I trying to say? Dehydration would be the first thing that we would die of if we didn't have any substance. So it is, often underrated as well. So macronutrients, essential nutrients required by the body in large amounts to provide energy and support for lots and lots of different physiological functions. I'm sorry, you can't see this quite. So energy calculation, this is a classic way of trying to calculate an individual's energy requirements. So you can find calculators online that will tell you based on your age, sex, weight, height, and the amount of exercise you do, basically what your energy or what your macronutrient profile should look like, perhaps how many carbohydrates, fats and protein you should have, and overall what kind of calories would be appropriate for you. Obviously they're a huge estimation, and if you were to have a consultation with a nutritionist, it's going to be a lot more in depth than just putting in a few numbers and getting that calorie estimate. So it would include also medical conditions. Obviously, if you're speaking to someone, they're going to take that into account, how much energy you require every day. So and then balancing macronutrients. So we need a balance between carbohydrates, proteins, and fats, and that proportion is very much debated. And we have in the UK the Eat Well guide. I'm not sure what it is in each country that you guys are in, but I believe you're maybe all around the world, I'm not too sure. And that we all have those government standards. And I think it's about 40% carbohydrates, 30% proteins, and 30% fats, I believe, for the UK, something around that. So, and obviously that's going to depend massively on that person. If they've got type 2 diabetes, we're not necessarily going to want them to have more than 40% carbohydrates, or be obviously careful about the type of carbohydrates they're having. So is there anything else I needed to say on this one? Or for example, another one would be cardiovascular disease. We'd want to make sure that fats as well were at the right level, and particularly the types of fats as well. So let me move this over here. So carbohydrates, now essential obviously for providing energy to body, and carbohydrates are broken down into glucose and then stored as glycogen in our muscle and our liver. So what that means is that we have this ready to go energy for the body. And if you are sprinting, it's that glycogen that's going to be tapped into, oh, sorry, the glucose will be tapped into first. That's your immediate store, and then your glycogen is going to be broken down for cellular energy. So I'm sorry, you can't quite see all my text here. Oops. Sorry, I've just got a portion of the screen on because I've got a few notes on the side. So sorry, you're missing out a few words here, but hopefully you can, it's not too much, I don't think you're missing there. So yeah, in clinical settings, carbohydrates are particularly important for patients with like high energy needs, maybe those recovering from illness as well. So the two types we have, as you probably know, we've got simple carbohydrates or simple sugars, we could call them. They provide quick energy, but they may lack nutritional value because they've had the fiber stripped away. They still do provide some nutrition. And you know, the difference between white rice and brown rice perhaps isn't that huge in terms of the nutrition we get. It may be that it's been overestimated how much the difference between white rice and brown rice is for our health. So although of course we should be aiming to have complex carbohydrates as much as possible, so these include starches and fiber, they offer more sustained energy and really help with our gut health and our digestive health as well. Obviously, they provide the roughage that our body needs to form healthy stools, and also provide the fuel for our gut microbes. So it's the fiber that you find in brown rice or whole wheat bread, for example, or beans, lentils, those kind of things that are going to provide actual fuel for our gut microbes to then produce something called short-chain fatty acids, which are very important metabolites to help reduce inflammation, for example. I don't want to get too complex here with all of this, but generally people are not eating enough fiber. The goal for those in the UK is to have 30 grams of fiber a day, and it does change in different countries. I believe America may be a bit more. I think it may be 35 grams, or it's different depending on if you're male or female. I'm sure some of you can correct me on that. So I think the average amount that people consume is 21 grams per day. So not enough, and this does have a huge knock-on effect on many different areas of health. So digestive health, or even certain cancers, things like whether we are going to develop even certain mental health conditions. There's many links with fiber, and it's perhaps not the most interesting area of nutrition, but I think it's becoming a bit more talked about now on its importance. So anyway, a bit of a diversion there. So going back to carbohydrates, I look at this quite a lot with DNA testing. So people have quite an individual response to how they process carbohydrates based on their genetics. So some people do have a predisposition to insulin resistance from eating simple carbohydrates because of the way that their body digests carbs, and the speed at which those are digested can very much vary. They can be digested quite slowly or quite quickly, and this can impact an individual's blood sugar response, and then can impact insulin release. So yeah, this is quite a useful one in terms of my work, DNA testing, and looking at people's individual response to them, and perhaps helping them to monitor or to reduce their carbohydrate intake, particularly if they're looking to lose weight. So, or making sure, for example, pairing carbohydrates with fats and protein can be a really useful thing to do as well, and in terms of stabilizing blood sugar levels. So that's something I always try and encourage patients to do, is to pair a snack or a meal, always a carbohydrate, to have it with a source of fat and a source of protein. And this has a much more satiating effect on us. It keeps us much fuller for longer. So now going on to fats. So fats have had a lot of bad press, I guess, over the years, but they are very much essential. We need them. They do provide a very dense source of energy. So looking at the amount per 100 grams, the amount of calories you get, it's 7 calories in 1 gram sorry, I've got that wrong, 9 calories in 1 gram of fat, whereas protein is 4 grams, as well as carbohydrates, they're also 4 grams. Sorry, I'm saying that wrong. 4 calories per 1 gram. So for carbohydrates and protein, and fats provide 9, so a lot more dense in terms of their energy that they contain. So, but we need them for the absorption of fat soluble vitamins, which are vitamin A, D, E, and K. And they are very crucial in protecting our organs, insulating the body, and producing hormones. So a lot of hormones actually need fats alongside them to be produced by the body. So as you probably know, we actually have 3 types of fats, even though I've just listed 2 here. There's saturated fats, unsaturated fats, and trans fats. So saturated fats, as you may know, these are found in animal products, particularly. Red meats, for example, are quite high in saturated fats, and some tropical oils such as coconut oil. So generally these are limited in diets given in a clinical setting to help manage cardiovascular risk, for example, because they're going to elevate LDL cholesterol, so that's low density lipoprotein, whereas unsaturated fats, they contain HDL, which is the good fat. So LDL being the bad fat and HDL being the good fat, which so HDL is found in unsaturated fats, which are your monounsaturated and polyunsaturated fats. These are found particularly in plant-based foods and fish as well. So your fatty fishes are going to have these unsaturated fats. So yeah, we really need the unsaturated fats in our diet because they actually help to clear out the bad cholesterol from our blood lipids. So they kind of have this cleaning effect, which is quite amazing. They actually cling on, the HDL cholesterol clings onto the LDL and eliminates it from the body. So I didn't talk about trans fats. So those are your trans fats are going to be the things that, well, basically they're going to be avoided because they have quite a negative effect on our heart health. They also increase the LDL cholesterol and reduce HDL. So things like your processed foods, chips and fried foods, and fried foods are going to be your main source of trans fats, and unfortunately are quite prevalent in many of our diets, and obviously fast food places, there's going to be a lot of trans fats. So yeah, I mean, we probably all have too much of these types of fats, but they are hard to eliminate completely from our diet. So I think from our Eat Well plate in the UK, I think there may be a small portion for trans fats, and I'm not sure what percentage it is of the diet, but they kind of, it's like a plate and they have a small sliver for trans fats. So yeah, it's not like we need to completely remove these foods from our diets, but it's just making sure they don't take center stage. So in clinical nutrition, so we're talking about in a more healthcare setting, fat intake is going to be adjusted based on health conditions such as heart disease, obesity, and pancreatic issues. So pancreatitis maybe, because some people can't produce bile, and if you can't produce bile in your pancreas, then you can't digest fats and metabolize fats properly. So that's going to be a problem for some people. And then protein. So protein is absolutely crucial for, essentially, it's the building block of our body. It's creating everything, our skin, hair, nails, everything is made up from protein in our bodies. So it's not surprising that we need a lot on a daily basis to keep up with the turnover of protein in the body. because obviously we're always needing to create new cells, new muscles, new skin, hair, nails. So as well, you could probably, a lot of people maybe are not, and this is debatable, but I would say a lot of people aren't perhaps eating enough protein either. So I think the recommendation is 20% for protein. I think I said 30% earlier, but I believe it's 20% of the diet. And I would say that's quite a low estimation. So you can do a calculation for this yourself if you wanted to know your protein requirements. It's the recommendation, I believe, is 1.2 grams of protein per kilogram of body weight. And that's the lowest that you would want to aim for. So depending, if I have a client who's an athlete, for example, or very active, I would recommend maybe even 1.8 grams of protein per kilogram of body weight to really help their body keep up with their metabolic demands and to increase muscle mass, of course. So also important for our immune function as well, tissue repair, trying to think what else. Production, as I said here, enzymes and hormones as well. So we have 28 amino acids and 12 of them are essential. Sorry, 12, 8 of them are essential. Leucine, isoleucine, can almost count them on my fingers. I've memorized them in my head. But yeah, we have 8 essential amino acids, and these are essential because the body literally cannot synthesize them on their own. So they have to come from the diet. So that's why plant-based diets can be an issue, because it's difficult to get all those essential amino acids potentially from one meal. So if you pair beans and rice, for example, you do have a full amino acid profile. But if you just have beans on their own or rice on their own, that's not going to give you all essential amino acids. And I've just remembered it's 9. I'm sorry, I've just got back from a trip and been traveling. So I think my brain's not quite very sharp today on remembering my numbers, but it's 9. So yes, so those 9 we need ideally in every meal and snack as well. So why we need protein? Muscle maintenance. Obviously, proteins prevent muscle wasting, and this is going to be particularly important for those who are bedridden in hospital, or they're undergoing chemotherapy and they're just not able to obviously use any kind of, or have any kind of weight bearing on them. So and some kind of muscle wastage is very common in hospital settings, but obviously keeping protein high is really important. But it can be difficult because a lot of time people perhaps undergoing chemotherapy don't have an appetite, and particularly may not want to have protein because it's quite I think it's a macronutrient that you have to really, perhaps people might reach for a carbohydrate more likely than protein, perhaps if they're in hospital. So that could be quite challenging. And it's really important for healing of wounds as well. So yeah, post-surgical patients need to make sure they're getting enough. And yeah, burns, infections, and certain chronic diseases. So it may help manage type 2 diabetes as well, because it may have an insulin lowering effect. So just thinking what else. Oh yeah, so what else do I have to say on this slide? So yeah, just the type, amount, and source of protein has to be tailored to that individual's need, whether that's renal or liver diseases. Obviously, if someone has renal issues, which is the kidneys, and that's where protein is processed through, is the kidneys. So they might have an issue with actually with metabolizing protein, and that's going to alter their protein requirements as well. Let's change my slide over here so you can see. So micronutrients, obviously micro meaning small. We're going to talk about vitamins first of all. So vitamins, they are organic compounds and they're crucial for lots of different processes around the body, of course. So they're going to support our immune function, energy production, our the health of our blood, bones, skin. I mean, obviously you'll know that the supplement industry is a huge multi-billion industry, and because a lot of people are concerned about that they're not getting enough vitamins in their diet, so that they feel they need to maybe supplement. And there's definitely an argument that people aren't getting enough in their diets. I mean, I'll just talk about that in a second, but an example of a few key ones: vitamin C. I did my master's dissertation on vitamin C and whether people are getting enough in their diet. And actually, it does seem that a lot of people do get enough vitamin C generally in their diet. And that when people are suffering from lots of colds and flus, for example, that is very much linked to not having enough in the diet. But it's one that's needed every day because the body can't store up a huge amount of vitamin C in the body. And then vitamin D, this is one that generally a lot of people are deficient in. So particularly in the winter months, of course, because we don't have the sunshine. So especially in the UK, it's a big problem with vitamin D deficiency, because we may only be synthesizing vitamin D through sunlight from the months of May to October. I've got that right. So our NHS guidelines, government guidelines, are to have a vitamin D supplement during the winter months of 10 milligrams. So this is the only supplement that is recommended by the government. So, but still a lot of people don't take this, and it's particularly important for the elderly to be taking this because vitamin D deficiency is linked to things like osteoporosis. So that's softening of the bones. So really important that I think that more people do take this, and potentially all year round as well. If someone's got the genetics that say that their vitamin D isn't being absorbed optimally, then actually I would recommend someone take vitamin D all year round, because it can be difficult to get in the diet. We only have a few dietary sources, which are egg yolks and fatty fish, and a little bit in some things like flaxseed oil maybe, but generally it's not going to be sufficient from just dietary sources alone in the winter. And then B vitamins. So these are energy producing vitamins. There's lots of them. I think there are 9 different B vitamins. So they have lots of different roles in energy metabolism and red cell production, creating new DNA as well, for example. And people do tend to be deficient in B vitamins a lot of the time. And these are generally tested through a blood test at quite routinely for people. If they say that they're exhausted, a lot of time people will have a blood test to look at perhaps vitamin D, the B vitamins and iron. And so when we're talking about what these deficiencies were like, a few hundred years ago, vitamin C deficiency would lead to scurvy, or B12 deficiency would be beriberi. So these things aren't so much a problem now, but still, like I've said here, actually most people don't have severe deficiencies, but actually most people probably have levels below optimal, at least in one nutrient for sure. So there's lots of reasons for this, and one reason is the way that our food processing has changed. So food practices have changed quite a lot over the years, and we're not getting the same nutrients from our soil as we used to. So because of basically increasing population, and the land has to be used all the time. I'm not an expert in this area, but I believe that there used to be some time for the soil to recover and to replenish its nutrients before then putting more crops in. But now it's kind of quite a constant turnover. So we don't have things like, particularly, the minerals that were found in the soil, like magnesium, maybe something like, I think I saw a statistic or a paper that said something like it was a crazy amount less, maybe 70% less than it used to be. I should have the source here, but it was quite a dramatic amount less than there used to be. So no wonder we are suffering from deficiencies. And also we're not eating generally the same diet that we used to. So a diet much less rich in plant-based foods, which generally have a lot of these vitamins and minerals we need. And we don't absorb the vitamins and minerals in supplements in the same way as we do from the natural food source, because generally the supplements we buy have the synthetic version, and our bodies don't recognize these as easily or as effectively as they do from, obviously, eating a banana is going to be very different than eating or than having a supplement. You're not going to get the same benefits. So minerals. So minerals are inorganic elements that aid in the structural and regulatory functions in the body. So vital for bone health, neurological function, and again, the synthesis of hormones, plus lots of other things. Those are just a few. So calcium, I'm just going to go through a few of the main ones. So calcium, as you probably know, essential for bone health and structure, and plays a key role in our muscle function as well, including how our muscles contract and relax. So we need calcium at different levels at different stages of our life. So particularly, as I said, the last one, vitamin D and calcium are absorbed together. So really important we have enough calcium intake in order to prevent things like osteoporosis and bone fractures. And then iron. So iron is crucial for oxygen transport in the blood as part of hemoglobin, as you probably know. You may remember in your science lessons, maybe in school, learning about this. So it's involved in energy metabolism and cellular function particularly. And iron deficiency can lead to anemia, which is more common in females, also due to menstruating. So generally, I believe we may not absorb it quite as well as males do as well. So this is characterized by fatigue, weakness, and generally kind of a decreased immunity as well. And then potassium and sodium. So we need these two for fluid balance, heart function, and nerve signaling, particularly. So, and also maintaining maintaining a healthy blood pressure too. And then magnesium. So this one is one of my favorite nutrients because it has effect in so many areas of the body. There's over 300 enzyme reactions that are involved in magnesium. So it helps us to create new DNA and RNA and things. And it's one that, a lot of people do tend to be deficient in the diet as well, because we're not eating many magnesium-rich foods like nuts and seeds and pulses and things. So we're just not getting it in the same way that we perhaps used to in the diet. So from a more clinical perspective, monitoring and adjusting mineral intake is really crucial for managing conditions such as hypertension, where we've got excess sodium, or anemia, where we've got iron deficiency, and electrolyte imbalances as well. So, like I was saying earlier, that water is often underrated or not perhaps given enough attention as it should be, and it's often called the silent nutrient. So it's kind of taken for granted, I guess, in nutrition science. I'm sorry, I can't see my whole screen here. It's annoying I can't make the screen a little bigger. Oops. So function of water or fluids, basically the same thing. Obviously, hydration, it's essential for maintaining our blood volume. So we are about 70% water, and all our physiological functions as well are very much relying on fluid intake. So also, drinking water does help to detoxify you. It helps you to dissolve nutrients, to get rid of toxins from the body and kind of flush them out, I suppose. And it does also help with absorption of nutrients. And we need them. We need, basically, we have our fat soluble vitamins. We also have our water soluble vitamins. So there's some nutrients which we actually need water just to absorb them properly in the body. And of course, on a hot day, you'll know this, that fluids play a key role in maintaining our body temperature through perspiration. And so managing our fluid balance. It's obviously our different life stages require different amounts of water every day, and the environment that we live in. So obviously if you're in a hot country, your requirement's going to be higher than those in a cold one. So and also, as we age, it's common that dehydration is really common as well, and there's can be a few reasons for that, but can be that as you age, it can get I think it's dysphagia, where it becomes quite painful to swallow, and this can cause actually just malnutrition in general, where it's basically not very comfortable to eat. So perhaps the elderly don't quite get as much fluids or calories in because of it's just not it's uncomfortable. So so also electrolytes. You'll know that if we are doing a marathon or something, we want to make sure we are replenishing our body with electrolytes, perhaps even as we're doing the run, because as we perspire or sweat, we're going to lose a lot of electrolytes as well. So things like sodium, potassium, and chloride. So that's then going to make us really even more dehydrated if we lose those electrolytes and we don't replenish them. And really important for nerve signaling as well in the brain and heart function. So electrolyte levels in a clinical setting have to be managed really carefully. So especially for those with like kidney function issues, any kind of kidney problems, that needs to be really carefully looked at, or chemotherapy, for example. And let me just see how many slides I've got left. Okay, great. I think we're doing okay for time. I do want to allow some time for you guys to answer any questions. I think I can see quite a few coming through on the chat, so I will speed through my last 5 slides fairly quickly. So nutritional assessment techniques. Now, this brings me back to all my studies, because we very much looked into this quite in detail of this mnemonic of nutritional assessment, which is, you remember, ABCD, pretty easy. So we have anthropometric, biochemical, clinical, and dietary assessment techniques. So first of all, we have anthropometric. This is an objective assessment of the body size, shape, and composition. So you've got things like your height and weight, very simple things like just looking at height and weight. This gives us an indication of growth and nutritional status. And then you've got BMI, which is body mass index, which you may probably have heard of. This is looking at your correlation of your body weight with your height, and there are some drawbacks to this, that it doesn't look at your muscle mass. So a really muscly person or a weightlifter might actually be in the obese category, even though they may actually have very low body fat, but they'll be heavy because they obviously have a lot of muscle. So it's used in clinical studies, but I wouldn't say BMI is the best thing to use in a clinical situation. So much better to use things like skin fold thickness tests. So this is like a caliper, and you look at the different areas on the body, and you take a measure of the amount of basically adipose tissue or fat that you get from that. So that is one of the best ones to do. And you have waist circumference. That's a really, really good one to do for a very quick measurement of someone's obesity. So if they have a waist circumference of over 100 centimeters, that person is at risk of things like type 2 diabetes and cardiovascular disease. And a DEXA scan is the gold standard way of measuring body composition. So it stands for the dual energy X-ray absorptiometry. I don't know if I'm saying that right. Anyway, it's the best way that you can measure someone's composition of their body, but it's very expensive to do, so generally isn't really used. And quickly, I'll go through the other ones. So biochemical methods, you've got blood and urine tests for nutrient status, looking at micronutrient status, protein status, blood glucose as well, lipid profiles, looking at your cholesterol levels, and then clinical observations. That's more of a subjective evaluation of someone's physical signs and symptoms. So perhaps if their skin and hair aren't very healthy, it could be an indicator of micronutrient deficiency. If they've got cracked nails or really brittle hair or brittle nails and kind of thinning hair, that could be a vitamin or mineral deficiency. And you've got, like, if someone's not got any muscle in them, that's obviously reflective of kind of protein, energy, malnutrition thing going on. And oral health, so if someone's got poor oral health, that's kind of reflective of their dietary habits. Maybe they have a lot of sugar in their diet, and they've got a lot of cavities because of that. And then dietary methods. So this is a common way to assess someone's diet, but it's not always very reliable, because we're relying on the person to give us an accurate analysis of their diet. And I don't know about you, but I can't remember what I had for breakfast barely yesterday, let alone last week. So when we're asking people to tell us, what did you eat the last 48 hours, which is, or 24-hour recall, for example, a lot of people aren't going to give you an accurate analysis, and they're probably also going to underestimate what they've eaten, and give you maybe a slightly polished version of, or maybe in their head they don't want to give you the real honest answer, so they estimate what they've actually eaten. So this is a big problem in nutrition research, and even as a nutritionist myself, it's very difficult when I'm asking people to give me a 3-day food diary. I don't know how accurate that is. And a food frequency questionnaire can also be quite difficult, because this is looking at, we say to someone, oh, how many times in the last month have you had brown bread, for example? And I'm not sure about you, but I wouldn't be able to give you an accurate answer on that. So again, same problem. But we have things like AI, artificial intelligence is coming through with this, and people can now take photos of their food, and it's going to give us maybe not a complete accurate analysis, but it's machine learning is getting very clever at these kind of dietary recall methods. So to stop these kind of patient recall bias issues. Okay, I'm going to come to a close. So I really want to allow some time for questions, but we've kind of actually gone through this, so I probably don't need to go any more into the diabetes, for example, and how we manage this. But essentially, that's really very much involved. What we need to manage is blood glucose levels, and that would generally be through carb counting. And diabetes management is a huge area for our public health to deal with at the moment, and I've done a lot of workshops for those who are pre-diabetic, and obviously it's becoming more prevalent as well. But there are lots of initiatives in the UK for people to help people get their diabetes into remission, with quite a lot of success. And then cardiovascular disease, also very, very common, and for this, we need to manage cholesterol levels, blood pressure, and just general inflammation as well. So having an anti-inflammatory diet is really important. So we lower saturated fats, we increase fiber to reduce the risk of heart attacks and strokes. And then renal issues, which is your kidneys, we need to manage electrolytes, the balance of electrolytes for our kidneys, lower sodium, potassium, and phosphorus, for example. And our goal is to obviously slow kidney disease progression, manage any complications. So I'm speeding through quickly. So quickly, I'll just say the different types of nutrition support. So we have enteral nutrition, which is, again, in a hospital setting. We have actually tubes going down the throat, and that nutrition is fed directly into the stomach. And then parenteral nutrition is actually intravenous, so it's through a syringe and it goes straight into the bloodstream. So both are used for different reasons in dietetics in hospital settings. And was there anything else I need to say? So yeah, the enteral nutrition, that's particularly done, it's the dysphagia that I spoke about earlier. It's often used when patients can't consume food orally. or they might have gastrointestinal issues, for example, as well, or they might even be unconscious in a coma as well. That could be one use of that. And then parenteral might be used more for those maybe going through chemo, for example, or they have kind of severe gastrointestinal issues as well. Okay, so, and then practical applications in clinical nutrition. So a study that I was involved in was the malnutrition screening tool. So this was used on elderly patients. We were asking them questions to see if they basically fill the criteria for being for having malnutrition. So that's quite a common one used in clinical settings, and again can be a problem with especially elderly people not quite remembering what they've eaten and things. So I did find that quite challenging when I was doing that study. And obviously individualized nutrition plans. Now this is more what I do at the moment, so but in a kind of non-hospital setting. So helping people with perhaps balancing their hormones or fixing their IBS issues, gastrointestinal issues. That's where I come in with a personalized nutrition plan for them. And then, yeah, like we just spoke about, the enteral and parenteral nutrition support in hospitals. And then nutrition and disease management. This might be in a healthcare setting, in like a community setting. You might have someone helping people who are pre-diabetic to help them get that back into remission, or to get into, or if they're diabetic, to get them back into remission for that. And then, like we spoke about on the last seminar, the nutrition education and counselling as well does fall under this. So to help people take health into their own hands and to actually help themselves, really, to help them to help themselves. And then monitoring and evaluation. So this is where we would just like continually assess a person's progress throughout their conditions, try and obviously check that they're maybe sticking to their diet, and if they have any issues, then we can like support them. And then ethical considerations in clinical nutrition. So briefly, informed consent. Obviously, we need to make sure clients understand risks, benefits, alternatives, that we give them really clear and comprehensive information, hopefully, and helping the patient to actually make those decisions for themselves and involving them in the plans that we're making. And acting in the best interest of the patient, prioritizing evidence-based interventions. All of this is just stuff, that would be hopefully kind of come naturally to a professional in industry, and it wouldn't, all of this obviously avoiding harm to patients, preventing complications, monitoring adverse effects, and prioritizing treatments based on need and cost effectiveness. And an interesting one, cultural sensitivity and diversity, making sure that we are being sensitive to individuals' cultural backgrounds, beliefs, everything, that we're not suggesting that they eat a diet that isn't in line with what they have at home, and being sensitive to that. And